The testbeds are a national programme run by NHS England and the Office for Life Sciences, and they're focused on turning high potential innovations into proven better outcomes and experiences and lower costs. And our testbed programme was focused on healthy ageing. We worked with local leaders, clinicians and patients to source a range of innovators who could work with us to transform ageing in East London, and HealthUnlocked were one of the partners that we selected.
Social prescribing has been a buzzword within the NHS for years, and some people think that it's like a relatively new term. But if you go through literature and stuff like that, you'd see that it dates back more than 20 years ago. I partnered up with one of our GP test sites where I did some social prescribing drop-in clinics where I'm going to see patients coming in, usually just seeing their GPs as they normally do, and then once their GPs or other healthcare practitioners such as their community nurse doing a diabetes clinic or a healthcare assistant would then identify, oh, this person would be able to benefit from a social prescription, and then they'll come and see me into a clinic where I use the HealthUnlocked social prescribing tool to provide them with some information around local services and online resources where they can find out more information about their condition.
Initially, we got really excited about a beautiful standalone social prescribing system from HealthUnlocked. And then we tested it with GPs, and they reminded us just how busy they are. And the immortal line from one GP was, "Opening another window on my computer is a deal breaker," which is so striking, it really stuck in our minds, and it certainly stuck in HealthUnlocked's mind. And they worked really hard to integrate their social prescribing solution into the patient record. So it's right there in front of the GP where they need it, and they can focus on the patient in front of them and make a social prescription really quickly.
So working with Care City has allowed us to understand the real local context and the needs of healthcare professionals and patients within the pilot, which took place in Barking, Dagenham and Redbridge. And what we found is that through working with them, we've been able to capture and harness new features and developments that could improve the product itself.
People say that bringing innovation into the NHS is slow, but really there's just a lot to do. It's competitive, it's complex, and there's not a lot of slack in the system to flex around new ideas and innovations. So it requires innovation partners like Care City and great innovations like HealthUnlocked. We were initially interested in people being diagnosed with dementia and the information that they were given, but we quickly realised that the ability for GPs to give information is a generic problem. We've all been in GP practices flooded with posters and leaflets in bigger and bigger fonts trying to grab our attention, and it just doesn't work. GPs need more information than they can hold in their head and their hand, and they need to be able to give it to the right people at the right moment, and that's where HealthUnlocked comes in. Looking at the experience of ageing, we at Care City were really conscious that there are moments in people's lives when they're deluged with medical information. And so we were really interested in HealthUnlocked's ability to organise that information and personalise it to people's needs and circumstances. HealthUnlocked work as a partner for us because they're great at digital. They also deeply understand medicine and clinicians. They're not playing at healthcare. They're a great partner for the NHS to solve big challenges like social prescribing, and that's why we loved working with them.
So what's been amazing working with Care City is working with a partner that truly understands how to bring innovation to quite complicated systems. When you're a company bringing new services to a system which has been in place for many, many years and has specific ways of working, there are a number of kind of change management pieces that you need to put in place in order to make that change happen. And when you work with a partner who understands the system but also understands the local dynamics and the context of the local population, you can do truly amazing things. So the collaboration has worked incredibly well from a technology perspective, but working with a partner that's able to navigate that complex in order to bring support to a local area with local services like East London and Barking and Dagenham.
CareCity and HealthUnlocked share a passion around healthy ageing. That's key to our partnership. We also focus on our strengths. HealthUnlocked know their business and their product. CareCity knows East London. So we've worked together to bring that leading digital innovation to East London's health and care system.
So due to our work with the HealthUnlocked social prescribing tool, we are also working with our local partners such as the voluntary services as well as the local authority in terms of expanding the database of information captured on the HealthUnlocked social prescribing tool. You may know that as part of the loneliness strategy released by the Prime Minister last October, local areas need to have a local social prescribing database in each area. So CareCity is currently working with a set of local authorities and CVS in order to curate and build this website wherein local services are going to be captured, both voluntary as well as commissioned services, so that anyone from patients to healthcare practitioners to or just for example like carers would be able to access information on the website outside of primary care, and also thus again reducing the pressure in GP sites where reducing that number of people coming in, and thus they were able to concentrate on patients who are in most need of help during that particular time.
We're delighted to have HealthUnlocked established in Barking and Dagenham and growing across East London. And we first of all want to focus on deepening that collaboration and making sure more East Londoners can benefit from instant social prescribing through HealthUnlocked. We also want to work with HealthUnlocked to help them to go beyond East London, to make their product available across the country to maximise its impact nationally.
It actually increases our rapport with the patient because they start to see that actually we are offering them more than just some medicine or a number for our counselling, talking therapies. Makes it a wonderful tool in a 10-minute consultation in general practice to offer these patients for different conditions. For example, we can refer patients on social prescription for anxiety, depression, cancer, respiratory problems like chronic obstructive pulmonary disease, diabetes, as well as some well-being conditions which we can refer patients on.
So we're now scaling out at STP level, we're working with hospitals here in London, we're working across councils, now providing the same product that's been through this testbed process, and now it's starting to scale nationally, not just in primary care but also secondary care. And that's great for the health economy and that's great for patients, but it's also great for the UK economy. Because what that means is that by going through this process and really getting the sort of virality and the understanding that this is a really valuable product, we've been able to invest in that as a company. And so, we've created new development roles that are specifically for people to focus on this product. This product is now has got specific product owners, and we've also hired salespeople specific towards selling towards the NHS as a key customer and stakeholder. And that would not have been possible to bring an innovation like this to the scale that it's reaching had we not been through this process.